content and material discussed in these podcasts are for informational purposes only and are not intended to be a substitute for your professional veterinarian's advice, diagnosis, or treatments. Always seek the assistance of your own veterinarian with any questions you may have regarding the medical condition of your pet.
Excuse me, are you in the know? This is a Noman.co production.
This is Dr. Gary Clemens with Talking Pets Podcast. Thank you for listening. Today we're going to be talking about something that you probably have had experience with, at least a friend, maybe a family member, and we're going to talk about epilepsy, which can also be called seizures, can be called convulsions, or in the old days, they said the animal was having a fit. You might know a family member or a friend that has epilepsy. You might know a family member or a friend who has a pet with epilepsy. It can be a very, very, very frightening thing. So we're going to talk about seizures and epilepsy and what exactly is an epileptic seizure. Seizures can be extremely frightening for the owner, but I hope to provide you with enough information so if one of your animals does have a seizure, you'll know how to deal with it and not freak out. Now, before I start my discussion, I want to tell you about two incidents involving seizures that I had. One was with one of my children, and one was with one of our dogs. When our oldest son was, a little bit less than a year old, my wife she hadn't left the house at all. She probably didn't trust me to watch my son, which I thought was absurd because here I am, I'm a veterinarian. I know how to take care of animals. And our son was just an untrained animal, not even potty trained, like our dogs would be at that age. So I finally convinced her it would do her good to get out of the house, get away. I think she had some kind of a weeding class or something she wanted to go to. I said, look, leave him with me. We'll be fine. We'll have fun. We'll do fun things. When you get back, you'll feel better and everybody will be happy. Well, I was watching my little boy for the first time and he was playing on the floor, having a good time. And all of a sudden, he stiffened up. The eyes rolled back in his head, sort of his muscles tightened up and he stiffened up. And I thought, oh my God, my son's having a seizure. But this went on for about 10 minutes. I'll tell you, I was scared to death. I called his pediatrician number and I got a recording to call somebody else. And my son had been to the doctor maybe a week or so before. And they told me to get his temperature. And I think his temperature was 105, something like that. And they said he probably has roseola. And I said, what is roseola? And they said it's something he probably picked up at the pediatrician's office. And I think they said it was caused by a herpes virus. Most of the time when children get roseola, they just get a rash. Sometimes you don't even know they have it. They can get a little bit irritable, which, most kids are anyway. But 1 in 30 kids, I found out, if the temperature is high enough, they can actually have a seizure. Now, I know they've changed what the recommendations on what to do if your kid has a high temperature, but at that time, they told me, after I got his temperature, put him in the bathtub, use tepid water, put tepid water on him until he cools down, and then take him down to Children's Hospital. I did that, and his temperature started coming down. He started coming around better, but he started crying, which I thought, that's great. My son's crying. That is a good sign. Well, we went down to Children's Hospital. I called my wife. Of course, she was freaking out. I said, meet us at the hospital. And when I got there, they took him away from us. They took him in the back, said, we're going to have to get blood. And I could hear him just screaming. I felt so bad for him. I wanted to go back. We wanted to go back and hold him and help calm him down. But they wouldn't let us do that. So they did tell me that high temperature can cause a seizure, can cause convulsions. If he gets a rash, it usually lasts for maybe 4 days. They said if it is roseola or the seizures, they don't cause any brain damage. And like I said, 1 in 30 can have a seizure. When they have a seizure like that, they lose consciousness, their muscles stiffen, or they can actually jerk. And after the seizure, they become very sleepy. Well, they did all kind of tests and said there was no infection or anything like that. So they assumed it was because of his visit to the pediatrician's office and he had roseola. They said he's going to be kind of irritable. We were able to take him home, but they said, he will be fine. He'll be kind of out of sorts for several days. Well, the next time I was allowed to watch my son, and I'm surprised I was able to do that. We lived in a very old house. It was built, I don't know, in the mid 1800s. And John was on the floor playing. I think it was during the wintertime. And he was having a good time. And I was, trying to entertain him. Our dogs were running around. We had some cats. And I noticed he was sitting up and he was making these funny motions with his mouth. And I said, John, what do you have? And I opened his mouth and pulled out a live wasp. Yes, it was live. Fortunately, it didn't sting him. I'm doing just a great job watching my kids for the first time. And I don't think my wife would let me watch the kid until probably when he was about 18 years old. She left the kids with me without her being there. So that was the incident with one of our sons, our oldest son. The next incident was with one of our dogs. Donna and I had a little long-haired Chihuahua, and her name was Beanie. Now, veterinarians, I love Chihuahuas now, but back in the old days, veterinarians used to call Chihuahuas rats on acid because almost every Chihuahua that came in would try to bite you. And I think the reason that happens, a lot of times Chihuahuas were owned by senior citizens. They were small, they could handle them easy, they could sit on their lap. And a lot of times senior citizens don't go out much. The dog doesn't get socialized. It doesn't get around as many people except for the seniors it lives with. So when it gets around other people, it's not socialized well. And a lot of times they will bite. Well, we were in the office one day and I had just spayed this little long-haired Chihuahua, and my wife came in and we had just recently had to put her old dog to sleep, who was almost 18 years old. She was a Golden Retriever Cross. And she was trying to decide what kind of a dog to get next. And when she came in the office, she saw this cute little long-haired Chihuahua that I had just spayed. I think she was about 2.5 pounds maybe. And she said, that's what I want. I want a long-haired Chihuahua. And I said, Donna, we used to call them kind of bad names. I'm not sure you want a Chihuahua. Well, that's what she wanted. We finally found a breeder near Milford, and we went to see them. And they had this one little tricolored long-haired Chihuahua left, and she was about 1.5 pounds. Nah, not even that big. And she was adorable. Well, needless to say, she came home with us, and she became just such an important part of our life. My wife just fell in love with her, and so did I. Well, one day I was taking them for a walk. We lived in an older part of Milford, Ohio, in a residential area with old homes and streets, and I would walk them on the leash. And we had 2 dogs at the time, Mikey, who was a little mixed breed, and Beanie, who was a long-haired Chihuahua. And our street was a dead-end street, so once we turned the corner onto our street, there were virtually no cars coming. So we got about 4 houses away from our house, and I took the leash off of both dogs, and I saw my wife, Donna, sitting on the front porch on the steps, and I said, go get Donna. They went flying down the street like a bat out of hell, flying up the sidewalk, and we had concrete porch steps, and little Beanie jumped, go up the first step. She miscalculated. She hit her face and her head on the first step, fell over on her side, and had a seizure. Well, I assumed it was from trauma, but of course my wife is screaming. Beanie knocked out a couple of her front teeth. I picked her up, jumped in the car. It was my day off at work, and I raced up to the animal hospital and examined Beanie, and by that time she was fine. So I assumed it was just from her being traumatized from the accident. Well, at a later point in time, at one time we owned a houseboat, and it was down on Laurel Lake in Corbin, Kentucky. And there were some pretty steep stairs that went up to a second deck, like a sun deck. Well, Beanie was out on the back deck with me, and then I saw her run up the steps, and I said, oh, now, Beanie, come down here. And she started coming down the steps, and she slipped. She fell down about 4 or 5 steps. I think she hit her head again, and she had another seizure. Well, I held her. It didn't last very long, maybe 30 seconds or so. And after that, she was fine. She never had another one. Those were what we call extra traumatic type seizures. She never had one after that. So let's get back to our topic, which is epilepsy, seizures, convulsions, or fits. So what exactly is a seizure? I'm going to read the definition that a seizure is a temporary involuntary disturbance of normal brain function that is usually accompanied by uncontrollable muscle activity. It's also called an uncontrolled burst of electrical activity. When I would talk to my clients about their pets having seizures, I would always say, do you own a computer? And I said, have you ever had your hard drive crash, your computer crash? And they said, yes. And I said, what happens? They said, well, we don't get the right signals back. Nothing happens. And I said, that's basically what happens. The brain is just this amazing, amazing computer. It can do so many different things. But when you have a seizure, there are electrical disturbances in the brain. It sends out abnormal signals to the body, just like it's crashing, and we get these different symptoms. So that's what happens when an animal has a seizure or when a person has a seizure. Now, let's talk about some of the signs when an animal has a seizure. When they have a pretty severe seizure, the signs can be very different. They can be anywhere from very mild, which can be what they call a focal seizure, where just a small part of the brain's involved, where maybe they just hold up one leg. There's a thing called stargazing, where they just turn their head up and sort of stare at the sky. Some dogs can chew. Some dogs can just stare like they're out of it. They can, when they have a severe seizure, at first get very confused. They usually flop on the floor. They can dog paddle, which is like treading water. They can jerk and twitch. I've seen animals foam at the mouth. Some animals defecate. Some animals urinate. Some animals walk in circles and bump into things. So those are different things that can affect them. We talked about focal seizures, which is one part of the body, and some of the breeds that can have seizures. Looking at some different publications last night, there were so many breeds: Australian Shepherds, Labradors, Beagles, Bichons, Belgians, Taverns, Collies, German Shepherds, Pugs, Yorkies, Maltese, Chihuahuas. Long-haired Dachshunds can have a type of seizure, and cats can have seizures. We'll talk a little bit about cats at the end, but most of the time seizures are in dogs. Our friends at Odor Exit have generously offered, for our listeners only, a bottle of their amazing odor-eliminating product, Odor Exit, and an ultraviolet black light to find those pet urine stains. This is a $50 value. In my 46 years as a veterinarian, I tried many products that were supposed to eliminate pet odors, but none of them worked as well as Odor Exit. Entering to win is easy. All you have to do is like and share my Facebook page, Talking Pets with Dr. Gary Clements, with one friend. That's it. One winner will be posted monthly on my Facebook page. Good luck, and thanks for sharing. The different types of seizures, there are what we call extracranial, things that are not caused by abnormalities in the brain. One is hypoglycemia. That's a low blood sugar. People can do that. If they have diabetes and their blood sugar is too low, they could have a seizure. We see that with little puppies. If they don't get enough nourishment, their blood sugar drops, they can have a seizure. We can see it with little Yorkies and Maltese because they're so tiny. If they don't eat enough when they're puppies, they can have a seizure. Liver disease can cause increased ammonia levels, can cause seizures. Hypocalcemia is another one. When dogs are pregnant and they're nursing a lot of puppies and they don't take in enough nutrition, their calcium levels can drop low and they can have a seizure. Certainly different poisons, organophosphates, eating too much dark chocolate, too much caffeine. Yeah, you wonder why people don't have seizures. Strychnine, those are some of the things. Hyperthermia, like our son, when the temperature gets too high, with heat exhaustion with dogs, they can have a seizure. And different infectious diseases like toxoplasmosis. Those are extracranial, things not in the brain. Things that are intracranial, one is called idiopathic, and they don't know why they have these seizures. Brain tumors, certainly, mostly in older animals. Encephalitis can cause inflammation, autoimmune disease, cerebral infarctions, where they have a blood clot in the brain, trauma like little Beanie had, congenital diseases, degenerative brain diseases, infections. When I first got out of school, distemper was still a pretty common thing if people didn't get their dogs vaccinated, and some of these distemper dogs would have a seizure. Animals with rabies can have a seizure. Certain viral disease, bacterial diseases, fungal, protozoal, and rickettsial diseases, and even some nutritional imbalances. One type of seizure, we used to call them grand mal seizures. Now they call them generalized seizures. There's always a loss of consciousness, and it affects both parts of the brain, both of the cerebral hemispheres. Myoclonic is where they maintain consciousness. It's triggered by something like light, a sound. They often have facial tremors. They can have head twitching. They can jerk abruptly if you touch them. And that's what I was mentioning. Wire-haired dachshunds can sometimes have these myoclonal seizures with abrupt or really loud sounds. We used to call them petit mal seizures. Now they're called focal seizures. It's where only one cerebral hemisphere is affected. And these animals can blink. They can have chewing motions. Or some owners have described it where they act just like they're not quite there. But the most common one is called idiopathic epilepsy. We're going to talk about that in a little bit. When animals have seizures, some of the tests that are recommended, and we don't always do this, the first thing I'll tell you is most of the time, most of the seizures we find are idiopathic. We don't know what causes them. The animal will have a seizure, they're better in 5 to 6 minutes, and that's it. They may never have another one. They may have another one in a month. They may have another one in 3 months. They may have another one in 2 weeks. But most of the time, they're right back to normal. So as a veterinarian, when animals would have a seizure, the first thing we always did was we do a physical exam and a neurological exam, and then we would do a CBC chemistry screen just to make sure liver and everything's normal. So the recommendation, if you went to a neurologist and animals having seizures, particularly with older animals, they would want to do an MRI, which is better for soft tissues looking for tumors in the brain. They'll sometimes recommend a CT scan, a spinal fluid analysis, infectious disease testing. They always do a glucose test or blood sugar test, liver function test, a full thyroid panel, and sometimes an electroencephalography. Let's talk about idiopathic epilepsy, which nobody knows what causes that. There is a group called the International Veterinary Epilepsy Task Force. And I'm going to read this. Here's what they say. To be classified as idiopathic epilepsy, which is the most common form, the dog or animal must have 2 or more seizures of intracranial cerebral origin occurring more than 24 hours apart with a normal physical and neurological exam between the seizures. The minimum database testing is normal, which is a CBC, chem screen, thyroid panel, and urinalysis. They all have to be normal. And the seizure characteristics must be identical from one seizure to the next. Idiopathic epilepsy usually occurs in animals anywhere from 6 months to 6 years of age. We've talked about different types of seizures. Let's talk a little bit about when to start treatment. This depends a lot on the owner, what they feel comfortable with. I had a neighbor down the street who had a St. Bernard that just recently passed away. That dog was having 1 seizure a week. That was a lot of seizures, and that dog was on medication at the time. To me, that's not very comfortable, and it wasn't comfortable for the dog, and the dog finally died. When to start treatment? Again, this International Veterinary Epilepsy Task Force says when an animal has 2 or more seizures within a 6-month period, when they have status epilepticus, where they just have continual seizures and don't come out of it, when they have cluster seizures, which might be where they have 3 or 4 seizures in the same day. They have a seizure, they come out of it, a little bit later they have another seizure. That's called a cluster seizure. Where they have a severe or prolonged post-ichthal period. Now, the post-ichthal period is a period after the seizure. The animal will act confused, they'll kind of sometimes stagger around, and eventually they will get back to normal. When they have an increased frequency or length of seizures, or the seizures are much more severe. Choosing therapy, we have to decide, first of all, the safety of the drug. How easy is it to administer the drug? Are you home often enough to do that? Side effects, because when they take some of these drugs, at first they sleep a lot. The interaction with other medicines they might be on. The dosing frequency. The cost of the drug, that can be a big one. If you have to do multi-drug therapy, the owner's lifestyle is really important. If they're able to dose at appropriate intervals, what if the dog needs medicine 3 times a day? That makes it difficult. And of course, the frequency of the seizures. I read that with the recurrent seizures activity, there's an increase of something called pacemaker cells. And the pacemaker cells, which can decrease the brain's ability to limit seizures, and they make it more difficult to adequately control seizures. So the more seizures the animal has, the more these pacemaker cells are stimulated, and then it becomes much more difficult to control the seizures. So it's actually better to start them on medication sooner than later. We used to tell people if they have 4 seizures a year, that might be the time. If the seizure lasts a long time, or if the owner just is frightened when they have a seizure, because the other thing you have to remember, if you work, they may be having seizures during the day when you're gone. One thing owners will note, sometimes they come home and the animal has defecated or urinated on the floor, something's knocked over, and they normally don't do that, so they think they might have had a seizure. The goals of the therapy. Ultimately, you want to stop all seizures, but that rarely ever happens. We've had it happen with some animals, but it rarely happens. You want to reduce the frequency of the seizures to an acceptable level. And, I think a seizure every 3 months, if it doesn't last very long, the average seizure is probably anywhere from 2 to 5 minutes long. Every 3 months is probably acceptable to some people. That's not. You want to minimize the side effects of the medication, and you want to preserve the quality of life for the pet. Of course, the owner has to be able to afford the medicine and treatment cost. with routine epilepsy where there have not many seizures, the number one drug we always use is phenobarbital. Phenobarbital has been around, I think it was only approved for pets in the last 8 or 10 years, but it's been used 30 years or so. It's a sedative, but it still works very well for most mild seizures. It's still relatively cheap, and it's usually given about 2 times a day. When you start them on phenobarbital, it can have some effect on the liver, but in all my years of experience, that's 46 and a half years, I never saw an animal develop liver disease that was on phenobarbital. But it can. So before you start them on phenobarbital, you should do some liver function tests. Now, a CBC chem screen is not a liver function test. There's a lot of things in there, the albumin and the SGPT and the ALP, different things that are indications of liver problems, but a true function test would be a bile acid test. So if that's normal, then we'll start them on a dose of phenobarbital. And we generally don't do that with older animals because one of the more common causes of epilepsy, we have to be more careful in older animals. One of the most common causes of epilepsy in old dogs is a brain tumor, particularly if it's their first seizure ever. The short-term side effects of phenobarbital are they drink more, they urinate more, they act like they're drunk, they have an increased appetite, and they can get kind of wobbly. Most of the time it's given 2 times a day. Sometimes it's given 3 times a day. And if it's doing a decent job, the seizures are either milder or not occurring as frequently, then we can always increase the dosage. Long-term side effects, as I said, in my experience, the liver toxicity was rare. There's one of the tests on a chem screen called alkaline phosphatase. That's going to go up. That can go up as high as, I've seen it as high as 10 times the high normal range. So it can really go up. So let's say the high normal is 150. It's not unusual for it to go up to 1,500 or 3,000. That's a normal finding. That happens usually within the first 1 or 2 months. The cholesterol can go up. If the ALT goes up or the albumin decreases, that indicates there could be some effect on the liver, and then we do recommend doing a bile acid test. You want to start this early on with the seizures. They're always going to have some weight gain with it too because they want to eat more, so it's important to decrease the amount of food they're on. And don't freak out because that first couple weeks, they're going to be kind of wiped out. If it doesn't decrease the seizures and the dose is in the normal range, and the normal range, 23 to 28 is the normal range. And as long as you're in that normal range, you can increase the dosage. But if you're getting outside the normal range, then you don't want to give any more phenobarb. Then you probably want to add a different drug. One thing also is if you're ever doing a thyroid test on a dog on phenobarb, the thyroid level is going to read low like the dog's hypothyroid, but it's not hypothyroid in the most part. It's just the phenobarb makes the thyroid levels low. And they do recommend monitoring. Once you start them on phenobarb, in about 2 or 3 weeks, check the serum levels of the phenobarbital. Now, we're still talking about animals with relatively mild seizures. Another drug that is a good first choice of drug is potassium bromide. It can also be used as an add-on drug, and it can also cause increased thirst, increased urination, ataxia, and sedation. It's a little bit more difficult, I think, to give. I think it comes more as a liquid medication, but it's certainly a good drug, and it can be added on to the phenobarbital. Let's talk now about what we call refractory seizures, and these are seizures that are hard to control. So when there's been 2 or more appropriate drugs that have been used and they fail to give adequate seizure control, that's what we call refractory seizures. And the reading I did, about 20 to 40% of all dogs with epilepsy can have refractory seizures. And I'll tell you, there's some dogs I've seen, I think German Shepherd was one of the breeds, we just couldn't get seizures under control and animals might have to be euthanized. One of the problems with this type of a therapy, they call it polytherapy, P-O-L-Y, when you have to use multiple drugs. One is cost of the medication. Neurologists are great to go to, and if you go to a neurologist, if you happen to live near a veterinary center like MedVet here in Cincinnati or the Care Center or some of these bigger centers that have a neurologist, a lot of times they will use some of the newer epilepsy drugs, and they can get quite expensive. So the cost is one thing. The frequency of clinic visits for lab tests, that's also, with certain drugs, you have to do more lab testing, and that can become costly. Increase side effects when you add drugs, because sometimes side effects will be the same with drugs, and if it makes them sleepy or what we say ataxic where they're wobbly, that could be multiplied when you have two drugs together. And sometimes confusion in the dosing schedule. I always recommend my clients get those little pill boxes that have AM, afternoon, and then PM, and put the medication in there. So if, let's say the husband gave the medicine and the wife comes home later and the husband's off playing racquetball or doing whatever they do, whatever we do, and she's not sure if he gave the medicine, they might duplicate the medication. That way, if you come home and you see that that PM dose was already given, you're not going to double up on the medicine. And like I said, there are many newer drugs. I'm not going to go into the newer drugs because that you can go over with a neurologist. There have been some studies with CBD, with a cannabis oil. This is not the marijuana oil, the part that causes people to get high. There's been a little bit of success with it, but they have to do a lot more studies. There's also, I think Purina has come out with a diet, a dog food, that has medium chain triglyceride diet, and there's been some success with animals with this diet. Let's talk about what to do if your pet has a seizure. Stay calm. That's the most important thing. Animals don't swallow their tongue. Sometimes they get a little bit blue in their color, but they generally make it through the seizure. Again, most seizures last anywhere from 2 to 5 minutes. Look at your watch. Look at your phone. Do something to make sure you can keep track of the time. Because if that seizure keeps going on for 5 or 6 or 7 minutes, you need to call your vet and get in there right away. Everybody's got a cell phone anymore. I know it's hard to do it sometimes when you're nervous, but try to record it, because when you go into the veterinarian, that's going to help your vet a lot, because they can see exactly what the animal's doing. Sometimes animals are having tremors and they won't be seizures, so if you have a recording, that certainly helps a lot. Don't restrain them. Don't hold them down real tight, because that's not going to help at all. You can talk to them. I would always tell clients, make sure they don't fall down any steps or anything like that. You can toss a comforter or a blanket or something over them. If you just gently want to talk to them, eventually they just look confused. Their eyes are bulging out. And when they're finished with the seizure, they're very, very, very confused. You want to reduce stimulation. So you want to turn off most of the lights. You maybe open a door a little bit so some light comes through so you can watch it. Turn off the TV, turn off the radio, talk quietly, because sometimes those loud noises can make it worse. And again, call your veterinarian if the seizure lasts more than 5 minutes. You don't have to go to the vet right away. I always recommend calling your veterinarian. Most of the time, they'll want to schedule a time to come in to take some blood work to make sure there's nothing wrong with the liver or anything like that that could be causing it. But always call them so they can put it in the record and then schedule a time to have them looked at. When do you need to be referred to a specialist? Well, that's entirely up to the owner. We've had owners want to go to a dermatologist the first time an animal starts scratching. The first time an animal limps, some people want to see a specialist. That's okay if that's what you want to do. Most veterinarians can start off dealing with epilepsy, a general practitioner, without having to see a specialist. But if your pet is on medication and the seizures aren't getting any better, particularly if they're on multiple medications, your veterinarian has an obligation to refer you to a specialist if there is one available. And always ask. Most of the specialty centers now do have neurologists on staff. That's when you want to go to a specialist. And again, when older animals have a seizure for the first time, oftentimes it can be a brain tumor. And then when you go to the specialist, they're going to say we need to do an MRI or CT scan or whatever. And the question I would always tell the client is, what happens if they do an MRI and they find a brain tumor? Are you going to have the pet operated on, or are you not going to have a pet operated on? There's some tumors like meningiomas, I think, that can be taken out and the animal can do okay. I had one client in 46 and a half years that took their dog up to Ohio State to have a brain tumor taken out. The dog was never normal after that. The dog didn't recognize them. It didn't know how to be house trained anymore. And they were sorry they didn't put the dog down, but they were very sorry that they ever went through with the surgery. So that's what I always tell people. Before you have spend a lot of money on the different testing, decide if what you're going to do if that animal does have a brain tumor. My recommendation always with these older pets was start them on medication, an older pet, and if you can reduce the seizures and they're getting better, then that's probably not a brain tumor, then treat them. If they're not getting any better with medications, then it probably is a brain tumor, and then your decision for euthanasia is up to you. So that's what I always tell people about specialists. Seizures in cats. there can be many of the same diseases in cats. They can have trauma. They can have diseases, toxoplasmosis, diseases of the brain. They can have some idiopathic signs. A lot of the symptoms are similar, and phenobarb is one of the drugs that we use. So I hope that's given you some information about epilepsy in dogs, a little bit on cats, what to do if your pet has a seizure. Don't get frightened. Most seizures can be controlled fairly well, but some take a lot of work. So hopefully your pet will never have a seizure, but if they do, you'll know how to address it. Thank you so much for joining me for today's podcast. I will post it on my Facebook page, Talking Pets with Dr. Gary Clemens. If you have questions about this podcast or suggestions about future podcasts, please post them there. So for now, I'm Dr. Gary Clemens. Please consider adopting your next pet from a rescue group or animal shelter. Spay and neuter your pets, and if God's willing, I'll be back soon with another podcast at Talking Pets with Dr. Gary Clemens. And for now, so long, love your pets with all the love they deserve, and have a blessed week.